I think like all the intrinsic roles, communicator is no different in that there is an inherent challenge in trying to prioritize all their learning needs within their training time. I think most residents will agree that communication skills are very important, but they're trying to figure out where to frame them in everything else that they need to do, particularly in their role as medical experts. I think also that as residents encounter more complex clinical scenarios, be it that the diagnoses are complex or the patient characteristics may be challenging or they may be particularly uncomfortable, communication then becomes very difficult to have. And while they get great training in the undergrad curriculum, often on the postgraduate side they may not feel prepared to deal with some of the situations that they're dealing with. So I think they acknowledge that it's important and that it can be challenging because of those reasons. There can be some challenges in developing effective communicators. The first, as we've talked about, is having that self-awareness, so ensuring that residents have the ability to self-reflect when they are having challenges, having the insight to recognize when things are not going well, and ensuring that you have a faculty member who is comfortable to have that type of conversation with the trainee. The other is to make sure that communication skills, and in addition to the other intrinsic roles, have equal time in the curriculum. So ensuring that communication skills teaching lives not as an add-on but integral as part of your formal curriculum and as part of your informal curriculum as well. Some of the misconceptions around communication skills training is that it's simply a matter of personality, that you're just born with it. And in fact, communication skills are just that. There are 60 odd years of research that tell us that communication skills can be delineated to specific skills that can be observed, taught, and certainly assessed. The second misconception is that, like fine wine and cheese, that communication skills training, just communication skills, only get better with time. And in fact, we know there are some studies that show that communication skills can actually deteriorate over time as we begin to use more closed approaches and don't take the patient perspective into account because we're busy and we're in a rush as a senior trainee. But we do know that if we don't pay attention to communication skills throughout the entire spectrum of training, if we don't layer on further training, if we don't observe training and provide feedback on it, then there's no opportunity for it to improve. Like all clinical skills, such as the knee exam, if you teach it only once and see it only once, then you don't know how it will evolve over time. And it's particularly important in communication skills training because if you can imagine in undergrad, you're teaching the basics, you're teaching how to gather information. Your opportunity to provide information back to the patient in a way that they can understand and remember, your opportunity to negotiate a plan, to decision make that is in a shared and respectful way. There's less of a focus on that in the undergraduate training. That has to be done in the postgraduate training, and it's really important to introduce it. And the third misconception is that communication skills are very vague. But in fact, the skills are quite well delineated, that have been well identified and exist in many communication skills frameworks that are out there. And as I've mentioned in the past, communication skills frameworks such as the Calgary-Cambridge Observation Guide, the Kalamazoo Guide, the Cohen model, the Macy model, these are all communication skills framework that exist and can be readily used by any faculty member when they're beginning to look at communications skills training.